Hello, am I audible?
You're audible, sir.
Yeah, okay.
We start in another 5 minutes. All are requested to ask your other colleagues to please join in.
Good afternoon, everyone. While we wait for more people to join us before we start, I would like to encourage everyone to post their questions if there are any on Q&A function. We will try to take questions towards the end of the session.
Good afternoon, everyone. Am I audible?
Yes. What?
Yes, Dr. Shubham, you are audible.
Okay. Hello, everybody. I'm Dr. Shubham Yadav, Medical Officer from NPCCHH-NCDC. As you all know, we gathered here for this webinar on national heat-related illness and death surveillance. As you all know, we have to report on IHIP portal. So we were facing issues and we were getting queries from different facilities regarding it. So we organized this webinar to alleviate your all queries. So as you all know, my screen is visible to everybody. As you can see on this map, this map tells about how many facilities are reporting currently from each state. So as you can see, it is not a good number. We have to improve the reporting. And that's why we have organized this refresher session on how to improve reporting and what are the problems that we are facing. So as if I tell about the data, that is the reporting on 11th March, the worst performing states/UTs were Andaman Nicobar, Uttarakhand, Jharkhand, Bihar, Assam, and Rajasthan. So, as we all know, heat season have arrived and temperatures are surging. So we have to prepare our heat stroke rooms. As you can see on the screen, the basic requirements in heat stroke rooms are dedicated bed should be there for the patient. Cooling equipment should be there like water sprays, wet towels, and ice pack should be present. For immersive cooling method, we should have bath tubs, body bags, and tarpaulin should also be there for our uh, tarpaulin assisted rapid oscillation method for cooling of the patient. So we will be sharing this PPT on the group. So if if we need to train the medical officer, pediatrician, and program managers, so reference link will be there as you can see on your screen, and also training details are present on this Google Docs. Also, IEC materials and have been disseminated to the respective districts and the states. So we should try to disseminate the following to healthcare facilities in the local language. As you can see on the screen, many local advisories and local ICs are there. So we should try it that way. Also, this public health advisory that you can see on the screen have been shared and for dissemination. And regarding this, along with public health the advisories that we have shared, we have to also see for health facility preparedness. And if there is any mass gathering that has to happen because of elections or for other purposes, see if there are ambulance preparedness is there, and also if rapid preparedness and heat health planning is present there. And it is the responsibility of from SNO level to DNO, and also of the medical officers and the reporting officers that are there that report on IHIP portal. This document is National Action Plan on Heat Related Illness that was developed by NPCCHH. If you have any queries regarding how to clinically manage a patient, or what preparedness should be there in the health facilities, or what is the standard operating procedure for heat stroke patient and heat stroke surveillance, everything is available in this uh, action plan. You can refer to it. Now there is capturing heat stroke cases and death. We have suspected heat stroke cases, then suspected it may be treated and a patient may recover, or it can be convert into suspected heat stroke death, and then we have confirmed heat stroke death. Now, regarding this is the important component. This is the main point why we have gathered here for data collection on IHIP platform, because this data goes to the higher authorities and it reflects the preparedness of India's healthcare facilities regarding the major problem of heat. So, this is the main purpose why we collect the data to assess the burden of illness and mortality due to heat in the population. And by assessing the burden, we can plan it efficiently and evaluate the impact of climate action and changing climate, how it surges heat and how it affects the health of the human being. Now, regarding the basic, because when the person is reporting on the portal, the first thing that he encounters is what is the definition of suspected heat stroke case. So as you can see on your screen, these three criteria are there for confirming the patient as a heat stroke case. First, the patient should have altered mental status that includes disorientation, seizures, delirium, etc. And secondly, the elevated core body temperature should be more than 40 degrees Celsius, or patient has tachycardia and wide pulse pressure and hot and dry skin is there, and deranged vitals are present. So this should be kept in mind if we are reporting on the portal the patient as suspected heat stroke case, and also correlate this with the temperature, outside temperature, and also the relative humidity that is present in your area or in your state or district from where you are confirming or you are reporting it. So this is about the case definition regarding confirmed heat stroke death and confirmed cardiovascular death. Confirmed cardiovascular death includes death that results from MI or heart failure or cardiovascular procedures, or CV hemorrhage, or death due to other cardiovascular causes. Now, this is the portal. I hope you all have this link, because you should report even if there is no case in your area. Like I have heard from eastern states and from northern states that they do not face a thing as heat stroke or heat is there. But we would appreciate it, and if the reporting comes as nil, if you report it as nil, at least we will know that your facility is prepared for knows what is the heat stroke definition, and if any case comes, we know what should be done. So please report it as nil case. It will also increase the numbers regarding for how many facilities are reporting it. Okay, in health facilities, we have P form level entry where they have to daily report the cases and deaths, that is from 8 a.m. to 8 a.m., 24 hours period. PHC and above should do it, and mandatory daily reporting is there. And I said, like, zero reporting is required. If you do not have any case, it doesn't mean you just ignore it, this IHIP portal. You just write zero in that place and submit it. Now I would request our colleague, Dr. Bhupesh, who who would help you in, if you have any queries, you can raise it and he will help in alleviating your queries. Bhupesh?
Hello.
Yes.
Yeah.
Sir, could you please share your screen and demonstrate how to report on IHIP portal, sir?
Yeah.
Sir, your screen is visible, sir. And if you can, sir, minimize this pop-up here on the screen, sir. Thank you, sir.
Hello again. I'm Bhupesh from WHO, Technical Support Unit. So today, this meeting is about heat-related illness for facility reporting form, where you can check how you can report form, how you can edit or delete this form, and whatever the timeline we have provided for edit or deletion. Then also we can review district and facility level functionality. So we can start this. So this is a facility level reporting form. So where you can select a form menu where heat effectiveness reporting comes.
Bhupesh, can you speak a bit closer to the mic?
Yeah. Yes. So this is our HRI form. You can see there is an indicate form, and below it is add patient record form. So when you click, you can enter the case-based data. So first, if you have emergency medicine, emergency pediatrics or casualty cases, you can directly enter their numbers and you can save this summary. If you have suspected heat stroke death, suspected heat stroke cases or deaths, confirmed heat stroke death, then you need to enter case-based data. Like, for example, we enter test, male, yes. So after filling all these details, you can click on save button. Yes, sir. Yes. So whatever the data we enter in this case, it is showing here. So still you can edit or delete this case. So suppose you want to edit. Like we want to edit final outcome. Yes, sir. So we mention as recovered. The date of outcome is 11. Then click on update button. So this data is saved successfully and cases are also submitted. Now, if you want to check this C, we entered one suspected heat stroke cases. One, it is showing here as a 1 number. And we also check in report section, HRI case summary. So whatever the cases we enter, it is showing here suspected heat stroke cases here. So now, if you want to check. So now if you want to delete these cases, you can
just a minute, Bhai, sir.
Yeah.
Sir, if you can speak a little louder on your mic
Yeah.
and to just recap on what Bhupesh ji told. So we have aggregate number of cases in emergency medicine and emergency pediatrics and casualty. So where we have to enter the aggregate numbers and followed by then to have report a suspected heat stroke death or a heat stroke case. Then we have to add a uh, case-based record. So here we have to go on add a new record, patient record, and then all the for patient details which was shown by Bhupesh ji to you. And then we have to fill it out and then we save it. And for that, the status of date of reporting is admitted, and then followed by after the final outcome when the patient is admitted, we know what the final outcome is. It's the patient is referred, recovered, or is died. Then we give the final outcome. And it is requested to please fill in all the columns of the form. And I can see some queries regarding the indicator form. And kindly provide. Rest we will. I'm noting it down and then I'll clear it at the end of the meeting. And Bhupesh ji, if you could be a little loud and also explain
Yeah,
how
yeah.
to delete the entry if someone has wrongly reported on the portal.
Yeah.
That is much required by the.
So
Before that,
yeah.
just 1 minute, if we can go above also. So once again, a request to everyone, if we see over here, this report does not only ask for heat stroke, but also asks for emergency medicine, emergency pediatrics. If in a bigger hospital setup, these two different departments are there, or if in a smaller setup, casualties are there. So Bhupesh ji, if you can just write in casualty 10, we'll try to show. So basically, after OPD hours, whichever patient is coming in emergency in a pharmacy or in the treatment room, these patients needs to go in the casualty. So nil reporting over here does not mean we keep all of these zero if there is no heat stroke case. We need to mention casualty numbers over here daily. Heat stroke cases or deaths can be zero, but there is a possibility that there is cardiovascular death or there is other reasons of death which can be entered over here. So in addition to heat stroke, the data captures also the emergency visits and all cause deaths over here. This is important because sometimes heat stroke may not be very apparent and it will be reflected in if your emergency visits are increasing or if your all cause death is increasing. So this is again a request. We are seeing a lot of data quality issue where casualty is also zero, cardiovascular is also zero, death in a facility is also zero for the entire state, which is not possible. So you don't have to enter line list of these 10 casualty cases. This is only aggregate number you have to enter. Don't worry, if you write 10 over here, you don't have to enter each and every patient's name and all those things. Only for heat stroke case and heat stroke death and cardiovascular death, you have to enter the patient record. This is to clarify that we should improve also on the quality of the data reported. If we go a bit below, Bhupesh, if we go to the add new patient record.
Yeah.
So few of these fields are mandatory. Quality of data over here is also very important. A few of the fields have drop-down menu, like for example, if we go to socioeconomic card or occupation. So please select the best possible option. In occupation, if we select the others, you have to write in detail about which occupation it is. This is frequently left empty. If we go again to the occupation drop down, you will see that there are many options over here. Most likely, the patient will fall within one or the other of these options that are provided. It's very less likely in 5 or 10% cases that it will be other occupation. So please take time and select the correct occupation so that the data can be utilized for better actions. There is also just before the onset 1.25, there are different options given over here. Please try to get history as accurate as possible and select the correct option from here. We can move on to the delete record demonstration, Bhupesh. Thank you.
Yeah. So whatever the data user can enter, so they can delete or edit the data, but within a period of 5 days. Like just now we have entered this case, so we can delete this case by clicking on delete button. So there will be no case. And you can edit or you can delete the data within last 5 days. So you can select this date. So this is for facility level reporting. Somewhere that data is not there in training their service. Like see, so like this. Over to Mr. Pati. Yeah, this data is there, but at some district level there is no data or maybe training.
We cannot hear you properly, Dr. Pratik.
Sorry, sir, I'm not speaking, sir, anything. I think Bhupesh ji.
Yeah. I finished with this facility level reporting.
Sir, that was a demonstration how to delete the case if someone has wrongly reported it on the portal. And then further, you can cross-check with the reports if that has been removed it from your portal or not.
Bhupesh, if you can demonstrate within the forms, there is one more option, I think. No, within the forms, above, if you go, drop down menu.
Yeah.
Above.
No, sir, on the tab of forms. Above, sir.
Forms.
Above.
Yes, sir.
Okay.
So it is not here, sir.
No
but
issues. Okay. So we can go to heat warnings. Can you click on the heat warnings and show where does that open to? Below, near the case definition, there is heat warning. Yes. So for every health facility user and district user, from the IHIP portal itself, there is a link provided to heat wave warnings that IMD issues for the current day and for the next few days. So from here you can see that. Can you go a bit down, Bhupesh ji? Yeah. If there is a heat yellow alert, orange alert, or red alert, it will appear in this map. Can you go back to the IHIP portal, Bhupesh ji?
Yeah.
Yeah. Can you select on the checklist to label heat-related deaths. So, in case there is a death within the facility, or there is a person who is brought dead, you need to fill this checklist and upload it on the portal. These are the criterias that are followed to label a person as heat stroke or heat-related death. This is a combination of clinical and environmental criteria, and it has to be filled by the medical officer. So if the person has arrived before death and you were able to take temperature, it has to be above 40.5. There has to be mental status change, that is seizures or delirium. No alternate diagnosis, and environmental criteria have to be met. If the person is coming with a temperature less than 40.5, but history of cooling is there before the patient came. So these are the criteria that has to be checked, and it has to be tick marked, and the form has to be uploaded. If a clinical assessment is not possible or the patient is brought dead, there are different criterias like history of chronic illnesses, environmental exposure. Yeah, we can go below. Please scroll down. So environmental criteria is there is active heat wave alert from the IMD, or if there is no alert, but the temperature on that day has gone above a certain level. So these criteria in this checklist has to be filled for every heat stroke case, death, and has to be uploaded. We can go back to the IHIP. So this will be downloaded from your browser. We can go to the FAQ part. So again, this will be downloaded. A FAQ, 3-page FAQ has been prepared for some of the challenges that you face in reporting. Few questions. Can we scroll down? Few questions that are commonly encountered can be visualized, and some answers you can get from here as well. Keep scrolling down, Bhupeshji. Thank you. Yes. So we can go back to the IHIP portal. Yeah. Can we go to reports once, please?
Yeah.
Also, yeah, so this has already been shown. You can check your previous data from this report section, HRI case summary. Also, if you have any problem with any portion of the portal, you can click on the report problem. Can we show the report problem option? Yeah. Can we click on that? So if you have problem with reporting the data on IHIP, this option can be selected, and few details when you fill and upload the screenshots, the IHIP team will be contacting you and will try the best to resolve it. So rather than sending screenshots to your district nodal officer and then to SNO and then to state national level, you can use this option on the website itself to describe your problem and enter your details over here, and the person from IHIP team will contact you. Can we go back to the portal, please?
Before entering this queries, please ensure that you have to enter the valid mobile number, whatever the user is using this ID.
Where can you change that? Can you demonstrate that, please? On the IHIP. Yeah.
Yeah.
So for can you click there and we'll just showcase that also.
Yeah.
So for each facility, yes, we'll come to that. Can you go to the test profile? Yeah. For each facility, there is a profile which has details about your medical officer, the contact number, and other things.
This is available for whenever they are logging as a IDSP P form user. So
Okay.
there they can edit their
Yeah.
number.
So from your P form, you can edit your phone number. The current medical officer in charge detail can be entered. We were talking about this mandatory preparedness assessment or at the home page. If you click on that, can you click on that, please? So for each facility, we were talking earlier that heat stroke room has to be prepared and ambulances have to be prepared. Some trainings have to be undertaken. So each facility has to fill this form once during the heat season, so we know what is the level of preparedness. Can you scroll down and yeah, these districts you have, these columns you have to fill and submit the form. Please ensure that this is done at the earliest. We can go back to the IHIP portal. Can you demonstrate the district level ID once?
Yeah, sure.
So while the login is happening, I'm looking at the question and answer. There are few questions about, please clarify, is emergency medicine and pediatric cases related to heat are to be reported. So suppose I have in my hospital total of 12 cases. 8 of them are due to respiratory, 2 are due to cardiac, and 1 is due to ENT, and 1 is heat. So total 12 cases I have to enter in the emergency, irrespective of the diagnosis. All diagnosis, all systems cases have to be reported into total emergency visits, irrespective of whether it is heat related, or it is infectious disease, or it is non-communicable disease, or it's trauma. You have to enter within the casualty or medicine or pediatric age groups. I hope that clarifies. There were 2 questions regarding this. The Andhra Pradesh state, the number of districts have changed. So we request you to, the state data manager from IDSP Andhra Pradesh, to kindly send us the list of those 28 districts and the facilities that come within that district. We will have to do it at back end and we'll make those changes. Bhupeshji, over to you for demonstration of the district ID.
Yeah. So I worked as a district user. So this is, they have a heat related illness dashboard, facility reporting dashboard, facility reporting summary, aggregate report, patient report, and city weather report. We start from HRI dashboard. So here, whatever the data they entered from 1st of March, so 2026, they can see the history of cases, suspected history of cases, confirmed history of death, total emergency. So right now they have not entered any cases. So in this dashboard, that column is also available. There is a geospatial map is available for the particular district. Daily, weekly, and monthly wise, this reporting trend and cases trend is also showing up. So now we are checking facility reporting dashboard. So here district user can check whatever the facility comes under their district, how many facilities are reported, how many facilities are not reported. So they can check what the issue they are facing while reporting. So like we are checking from 9th of Feb to 11th of March. So only 1.5%, 98.5% reported and 1.5% not reported. Here also they can check daily facility reporting units as a percentage. This is a breakup of their district facilities. Like total facilities 55 and 68% is reporting. So here also they can verify and they can check. No, we can check facility reporting. So in facility reporting summary for this particular district, sub-district wise breakdown is available. Total number of reporting units is 9. So it is available as on daily basis how many facilities is reporting. So like on 5th of March, 9 out of 9 is reported, and 11th of March, 9 out of 8 is reported. So percentage wise average reporting is also available here. So they can check and they can distributor can confirm with facilities about the reporting pattern and reporting form.
Bhupesh, if
Yeah.
we go to the never reported reporting unit, can we see the names of the facilities that are not reported? If you click on 0, yes.
So
Okay.
data is 0, that's why it is not showing
It's
any.
100% from Amreli.
Yeah.
I
No.
request you to go a bit
Yeah.
slow,
Okay.
please. Yes.
I just changed it.
Okay.
It will show. Now it will show never selected.
So for district nodal officers, this is a useful function when the reporting in your district is not 100%. You can review which of the facilities have not reported from this function. Can you show it once again a bit slowly, please?
Yeah.
Yeah. This is within the facility reporting summary.
Yes, facility reporting summary.
Okay.
So I selected today's date. And total number of reporting units is 9, and out of 9, today 8 are reported.
Can you select Bagasara once, the third one?
Third one.
No, the never reported ones.
হ্যাঁ বলুন ভালো আছি
So these four facilities are not reported.
Okay, thank you. We can move to the next one.
Yeah.
Next option in the dashboard.
So this is aggregate reports, whatever the data they have under the this all facilities are entered. So this will provided the aggregate numbers of total number of patients in the day and medicine pediatrics, health emergencies, in cases of stroke, like this. With the daily basis of data.
Can you go to the right beyond the relative humidity? So to the right, a bit more to the right. Yes. So for district nodal officers, you can look at the correlation between the heat stroke cases and the temperature as well over here. IMD data automatically comes within the IHIP portal, and you can look at here whether to see if there is correlation between the heat stroke cases and the temperature and humidity that has been observed in the district. If we go to the left a bit, left side. For quality of data, you can see over here that still go to the left, the first part. The adult emergencies and pediatric emergencies or the total emergencies, you can see many of the days it's 0. So all facilities within the district, including district hospital and the CHC, if there are no visits to the emergency room or casualty, it's a bit difficult to understand. So this shows the quality of the data which we need to improve as we go forward. Over to you, Bhupeshji, for the next function. Thank you.
So next part is question reports, but within this period they have not entered any cases that are data. It can improve number of reporting and facilities, facilities, the location of residence, last occupation, whatever the data they are entering in forms, so it will show that. Yeah. So it show their city weather reports, today's maximum temperature, minimum temperature. So this is for district users. Now I will log as a state user.
Bhupeshji, before that, can you show the mandatory assessment for district level users?
Oh, yeah.
So similar to the preparedness assessment for a facility level, there is also a district level assessment, which has to be filled by the district nodal officer. This includes a few routine questions about action plans, number of hospitals, number of heat stroke rooms, functional in the district, and other questions regarding preparedness. This is all based on the advisory that is shared by the government and the Department of Health and Family Welfare from time to time. So all district nodal officers are requested to fill this immediately once. And if there are any changes in preparedness, as and when the changes happen, you can submit and fill the form once again. We can go back to the IHIP portal.
And for districts, sir, it is requested to please fill in the forms. We have very few responses on the district preparedness, and we would like to know the preparedness for the district. And for the heat stroke management units, so all the districts are also requested to make sure 100% facilities for DH and SDH having a heat stroke management unit.
So I logged as a state user. So for state user, this is almost similar menu with state users, like heat related illness dashboard, facility dashboard, and reporting summary. So this is similar with state users. But for state users, we have one extra menu called administration. So here administration, this state user can click on user management. So this is a HRI health facility master list. So whatever the facility comes under their states, these all facilities details are showing in facility master list. So here state user can check whether this facility is active or not, and also state user have this have authority. They can edit or they can enable or they can disable the facilities if required, like for this one GS Hospital Tamil Nadu. So if they can click on edit here, and if they don't need this facility or they don't want to report this facility, they can click on this checkbox, disable facilities from HRI reporting. So these facilities will not be able to report. So this is one functionality for state user to disable or to enable facilities.
I want to add over here that in the remarks section, please do mention the reason why you are disabling the facility. It's a mandatory column field. So whether it's a facility is no longer operational or it is the nodal officer or any reason you feel for why we are disabling this facility needs to be entered over here. This is a repeated request that we get from states to disable facilities. So from the administration drop-down menu, this option is possible to enable and disable the facilities. Similarly, there is a assessment, mandatory preparedness assessment for state level as well. We again request all the state nodal officers to fill in this form so that we can have a record of the activities being undertaken at the state level. If we can go back. Bhupeshji, can you demonstrate how from IDSP district data managers can enable the facilities? That error that shows that health facility is not active.
for state user.
So
So,
for district user.
also you're talking about IDSP district user.
For example, few NPCCHH health facilities,
Yeah.
they share the screenshot that the facility is not active. So from the district data manager ID, it can be activated, right? You were mentioning.
If any facility is closed or deleted, so if they want to open that facilities, so IDSP district user can also open or close this facility. But this is different from HRI, because we already given this functionality to HRI state users. So from here they can delete, or they can they can enable or they can disable these facilities.
Okay.
From IDSP district user, they can create a new facilities.
Can you demonstrate that once?
So from I log as a district user, this is learning portal, and under administration menu, have to click on manage health facility. Here there is one option came, request for new health facility. So by click on them, they can create any facilities, ownership, public or private, facility type, PSCs, health sub center, CSC, sub-district hospital or district hospitals, labs, whatever the facility have, facility type, PSC, facility name, whatever the name is special. Name of facility, date of enrollment, status, they want to open or close this facility, and after filling this mandatory details, already this IDSP district officer knows very well. After filling
So
this,
once they create a
details,
facility over here, will it also be active for
Yeah.
HRI?
yeah,
Okay. Thank you. But they have to create for P form, not for L form. Okay. Dr. Pratik, over to you, please.
Yes, sir. So, sir, I was just looking at some queries in the chatbot. So there was a query like if a person dies and then there is a suspected heat stroke death, and then we have to sometimes, if that death is confirmed as heat stroke death, then we again have to add a new patient record for the confirmed death. No, you don't have to add a new patient for this confirmed death. Just edit on the record which is updated at the facility, and then you have to give there is another section 3 which is there, which says that it is a confirmed heat stroke death, and further then ATR form which has to be submitted on that portal within which can be downloaded from the portal and then submitted on the same case patient. Right. And when do we edit reports and what time period for that? So, sir, to edit the records, it's 5 days we can edit and delete the record of the patient if it is wrongly added, or you have to change the final outcome of that case which is reported. And also don't disable the facilities which have temperature which is below the heat period or 25 degree. Just report 0 and submit that. And yes, the recording will be available on the NPCCHH channel. It will be there. Any more queries if are there? Yeah, please. We are open for replying to that. There are cases where existing P-form credentials work on IDSP, but not working on IHIP. We get an error like facility not enabled for HRE reporting. So yes, it may be the facility has been disabled for HRE reporting. You can contact your state nodal officers. They can approve your facility as HRE reporting facility.
Bhupeshji, can you show how to edit from suspected case to death within the form?
Yes.
From suspected cases to death.
Yes. So as we can see over here, right now it has been selected as patient is admitted and has not improved after cooling and rehydration. So suppose I submit this data today, save it, and I submit it. This is submitted as a suspected heat stroke case. Now tomorrow, if I want to, the final outcome over here is showing as red. I can edit the data tomorrow if the patient is still there, or after the reporting this patient, there is a change. We can change it status final outcome as died and date of the outcome as whichever date the outcome has occurred. So if you say patient has died, it will ask you for more details, whether it's a heat stroke confirmed or it's a suspected heat stroke case. If you have not been, so this is based on the criteria. If you can go up, Bhupeshji, checklist criteria. You can download the checklist criteria from here, checklist to label heat stroke death, fill it and see whether the criteria is being met or not for heat stroke confirmation. So once it's confirmed, we can go back to the IHIP portal, and in this you can select as yes. So once you select as yes, you have to record the date of the date and time of death, and which of the following details are available: clinical case sheets, post-mortem report, or is there a 3-member committee or NPCCHH death investigation form. So select multiple options and you can submit the data or update the data. So you don't have to, and you have to upload the file that you are saying is available, which is mandatory. Otherwise, we'll have to come back to you and get the data again from your state and district officers. And you can update, click on update, and this will be saved. The same case which yesterday I entered as suspected heat stroke, same thing can be changed to confirmed heat stroke case or confirmed suspected heat stroke death.
Yes, I think all the queries and all the
There is a
reporting related
question
issues
on
are.
whether all
I hope everyone is now refreshed on
Pratik,
the.
over to you, please.
Yes, sir. And thank you, sir. Thank you, Bhupesh, sir. And I hope everyone is now refreshed on how to report the cases, how to delete them, how to edit them, and how to report it on the portal. And we expect the reporting to rise from your respective states and facilities. And also, we request to please set up the heat stroke rooms. The states are requested to please make it mandatory for district hospitals and sub-district hospitals to have a heat stroke management unit. If the state PIPs are still to happen, please ask fund for it to make it functional heat stroke management units in your states. And further, we would ask all the facilities to be present and be available for the heat stroke management of cases, and the ambulance should be equipped to tackle the cases. For any further more queries, we are open to address your queries. Please write us on our email or report to your state nodal officers. They can contact us, and to the WHO team for any portal related issues also. Thank you, and I'm ending the meeting now.
Thank you.
Thank you.